I'm going to bring on Dr. Antor. She is an ON, and this topic is near and dear to my heart because I just had a baby, and a lot of moms have, they've said, "Hey, Blessing, we need to talk about how we can bounce back to work, after baby, especially after the kind of year we've had. We needed to talk more." That postpartum health that has been so difficult for a lot of women that are either isolating to work in a different environment. So, Dr. Stewart, thank you so much for joining us. How are you?
I'm good. Thank you so much for having me, Blessing. I really appreciate it.
So, the topic today is how women bound to work, home, and more after birth. I have a 16-month-old at home, and I know a lot of moms are expecting this new environments that we find ourselves. And you've done a wonderful job. You've been on our podcast, and we've talked about postpartum health. So personally, I find this topic very interesting, and and I've had 3 babies, 3 C-section, and I know how tough it is to go back to work. And I wanted us to discuss this because we've not paid a lot of attention to those moms that are pregnant because we're just kind of like, hey, it's all the working moms. But how about new moms, especially moms that are just coming into motherhood? So I have a few questions to ask you. But before I do that, can you just tell us a little bit about yourself and what you've done in the last couple of years as an OBGYN?
Sure, absolutely. So I'm Angie Stower. I am an OBGYN and I specialize in pelvic and sexual pain and sexual dysfunction. I am part owner in my practice, and I have a nonprofit that supports education for pelvic and sexual pain disorders to try and educate both the public and the medical world about what I do. And I'm a very busy mom too. I'm married. I have 2 little children, ages almost 6. Gosh, he turns 6 day after tomorrow, and an 8-year-old. So I am a busy mom too. And I've had 1 C-section and then a VBAC. So I have lived through the postpartum myself being a working mom. And I think that's really kind of where we get a lot of the pressure, because not only are we working moms, and then we're also postpartum, and it's difficult.
Absolutely. So maternal health and childcare always generate a lot of attention, as you know, especially with, especially among women of color, Black and Latinos. What are you hearing as an OBGYN from your patients with regards to delivery and postpartum care right now?
So a couple of things that moms are often concerned about. Number one, they're worried about how quickly they can bounce back. Women, may have the opportunity to take a full 12 weeks of FMLA, but they may not be allowed to do that financially. And so a lot of women need to get back to work as quickly as possible in order to be able to provide for their families. Single moms, women who are in dual income households where their income really is important to be able to put food on the table. So a lot of times women are concerned about how quickly they can get back. There's also a lot of concerns about things like postpartum depression, breastfeeding, pain control. I think it's kind of a big conglomeration of things sort of all at once in that immediate postpartum time period.
Oh, absolutely. And I remember that very well with my 3 kids, and just the amount of pressure that I put on myself, in order to go back to daily activity right after surgery. I had I've had 3. So why do you think women like me put so much pressure on ourselves to return back to daily activities after surgery like that?
Well, having listened to a little chunk of what happened in the little session before us, that's it. That's why. As women, even though we're immediately postpartum and sometimes post-surgical, we are not just putting the pressure on ourselves, but it's external too. We are expected by society, by our spouses, by our loved ones, and by our children to just still be mommy and still take care of the household and still work. Our bosses want us to continue being our absolute best like we were before. And I think it's not actually just internal stress on ourselves. We feel the external pressure to be everything. And as women, we just do it because that's how we work.
Oh, absolutely. And I know this, this might be a little bit a different tangent, but I wanted us to talk a little bit about something that we've seen in the news recently, which is the opioid epidemic that has, it's been in the news for many years, obviously, but many are unaware of how opioids can actually slow down recovery after surgery. I know when I was in the hospital with 3 of my kids, I was given options, all of them opioid-based option. Can you tell us a little bit more about, this pressure, right, to return back to work and the need to whatever pain reliever that can really help me, right, go back to work ASAP. Can you tell us a little bit about this opioid epidemic and what you're seeing and hearing when women want to make that recovery back to work?
Absolutely. The opioid epidemic is massive. The vast majority of people who are addicted to opioids initially got that prescription legally. So women, unfortunately, immediately postpartum are at hugely increased risk, even above general society, of developing an opiate addiction. If you have a C-section, you're sent home with a bunch of opioids and you develop postpartum depression, you can see how that might be a really good setup to start having issues with an opioid addiction. We also see it in just regular postoperative patients who are not immediately postpartum, but women who are going in for other things like hysterectomies. The fact is, there are options to avoid opioids in surgery, which is maybe a little known fact and part of what I do in some of my education. A lot of my pain patients already have had issues with opioids in the past, and being able to operate on them safely it is huge for me. And I want to be able to provide options that are not opioid based. There's also, considerations for the baby, because opioids do pass through the breast milk. And as you were saying, it slows down your recovery. And all of us have really big motivated driver to get back to being mommy, being wife, being able to be the, kick-ass women that we are and running our businesses. We want to get back to work. And
absolutely. I think that was my biggest driver. And, speaking to a lot of moms in our community, especially those who are seeking to manage, their pain after baby, I know that managing that pain is so critical. So what motivated you, especially as a mom, what motivated you to adjust your own approach to surgery and providing a better recovery for moms like me? And I don't want to go into my details yet, but, I know that there's a difference between, going, the opioid approach and the non-opioid approach. But what motivated you to adjust your approach as a mom and as an OBGYN?
I actually have a very specific experience that motivated this. And I know you and I have talked about this, but my husband and I actually housed hockey players in our home for several years when we lived in Iowa. And between 2 of the summers, something happened to one of our kids. He came back a different guy. He was moody and sullen, and we couldn't figure out what's going on. It was very atypical for him. And so I called and talked to his mom and found out that his 2 best friends had overdosed at a party over the summer. They'd been in a graduation party. Their mom was a nurse. They were 2 of 4 boys, the 2 older ones. They went to a graduation party and got into what they call a Skittles bowl, which is basically whatever drugs the people that were attending the party could find in their parents' cabinets, poured them into a big bowl, and people were just taking handfuls of them with alcohol. These 2 boys, the younger ones, started feeling ill, and they went home, and their mom found them dead in their beds the next morning when she came home from her night shift. And that broke my heart, knowing that these were leftover prescriptions. And I was like, I'm a doctor. I write these prescriptions. Some of those scripts that killed that kid could have been mine. And I just lost it. And I was like, there has got to be a better way to do this. And I started working very hard and educating myself about other options for being able to get to an opiate-free protocol. And it took me a couple of years to get to where I could go completely without opioids. And the majority of my patients, I do still have some that need the occasional here and there, but I do the vast majority of my surgeries, including C-sections, completely opiate-free.
Oh, I love that. I wish, I think you already know this. I wish I could come over to your city and your practice to have the next baby. That's if I have another one, right? So what do your patients focus on the most prior to surgery? Because I know when I was I was preparing for my second baby. That was when I really realized that, okay, we've had the first C-section and now we're going to have another one. And I know there's so many other health issues, right? Why women go to the hospital, whether it's for liposuction or breast reconstruction or, an abdominal surgery, whatever that could be. But what do your patients focus on the most prior to surgery? And what is the one question you wish that they asked more frequently prior to that surgery?
Oh, there's a lot of things that are focused on prior to surgery. I would say patients are wanting to know how long the surgery is going to take. That's probably my number one question. Number two, where are my incisions going to be? Am I still going to be able to wear my bikini after this? I get a lot of questions about like what I'm actually doing in the surgery, what we're removing, what we're not removing. And a lot of patients will ask, how much is this going to hurt and how long will it take me to recover? Those are kind of the basic questions. And I think there are some really good questions that get missed. Things like, for me to recover the quickest and the safest way, what can I do? How can I prepare myself to be as ready for surgery as possible? And what can I do to bounce back faster? And what can we do for pain control that doesn't require me taking opioids?
Absolutely. Absolutely. I think that's a great question. So in the last 12 months, 57% of OBGYN have stated they increase their use of non-opioids, which I think is fantastic. So can you tell us about your approach and the available non-opioid options you're using to manage pain surgery? And how has this approach impacted your patients? And what has been the experiences of, the moms of women that you've seen?
For sure. So there's a whole protocol that I use. If you're in the medical world, and even if you're not in the medical world, you may have heard of something called ERIS, which is Enhanced Recovery After Surgery. It's just basically a very fancy name to talk about any number of different protocols that are used and recommended by professional societies to improve the recovery after a surgical procedure. They've been used in pretty much all sorts of generalized type procedures, general surgery. The colorectal surgeons were some of the first to like really jump on this bandwagon. For some reason, OBGYNs like lagged. I have no idea why this is, but there are still OBGYNs that I talk to now that think I'm absolutely off my rocker for trying to do an open abdominal surgery like a C-section with no opioids. They think I'm crazy. They think it can't be done. And I'm like, well, I've been doing it for years, so obviously it can be done. The question is, how do I do it? There's a lot of different ways to kind of approach an ERIS protocol, but a lot of times it requires some preparation on the part of the patient, making sure that they're healthy, that they've exercised, that they don't smoke. And then there's things that we can do in the operating room. Specifically, I do non-opioid medications through the IV. I request that my anesthesiologists use non-opioid options through their spinals or through their epidurals if they're using that for labor. And then I use a long-acting injectable medication in my incisions called Exparel. It lasts for about the length of time that the incision requires to heal. So the first 5 days or so after the surgery, that the incision remains numb. And so patients get really good incisional coverage for that. They just don't hurt as much. And then after surgery, we do scheduled Tylenol and Motrin, or Tylenol and ibuprofen. And then we also make sure the patients get up and move and eat. And I will tell you, women are crazy, but they want to get up and change their baby's britches immediately after delivery. And being able to say, hey, I'm going to have your Foley out within 6 hours. You'll be able to do all the stuff that you want to do, get up and pick up your own child. And for them, that's golden.
Oh, absolutely. Thank you so much. We have a few questions. Is this approach, again, I know we just talked a lot about C-section. Is this used beyond women's health procedures? For example, can we use this for men procedure? Can we use it for things like hernia or wisdom tooth extraction, something like that?
Yeah, pretty much most surgical procedures can use some type of ERIS protocol. In fact, I think pretty much all of them do. I mean, even now, dental procedures, they'll tell you to, take something on your way in, to take some Tylenol before you come in. The certain parts of the protocols get changed based on age. The injectable medication I use isn't used in children yet, although I think there's going to be an ongoing study sometime soon. So there are certain things that can't be used in certain places, but ARIS protocols can be used in all surgeries.
Absolutely. And last question before we wrap this all up. What should women do if their doctor doesn't offer them a non-opioid option to manage pain after surgery? And where can people go for more information?
Well, I think the first big thing there that you pointed out is to ask. Ask your surgeon, do you give the opportunity to limit opioids after procedures so that I can get up and I don't have nausea and I don't have constipation and I feel better and I'm in charge of my faculty. So you've got to ask. And if your surgeon says, no, I don't do that, feel free to say, thank you. I'm going to find another opinion. There
Absolutely.
are surgeons pretty much all over the United States that are working with ARIS protocols, and there may not be that many of us that are like full on opiate free, but there are ones who will say, oh, yeah, absolutely. We use the ARIS protocol. This is what I do, and this is how we limit our opioid consumption in patients afterwards. So find another doctor. I know it sounds kind of mean, but I never try and take a personal approach to getting my feelings hurt if a patient says, you know what, hey, I'd like to see what another doctor says. Usually I'm like, great. I want you to feel comfortable with what you're deciding on. And if your doctor gets angry about that, it's probably not the right doctor for you anyways.
Oh, it's always great to get second opinions. Thank you so much, Dr. Storer, for joining us. I think somebody said that another question came in from the audience, which is in line with what we just said, which is where can we learn more about non-opioid options? I'm not sure if you answered that.
I don't think I specifically answered that. No, there's lots of different places you can go for information, but specifically related to this, there is a website that was put out. Here, let me see if I can find it. Here it is. So it's yourxfactor.com/MH for Mother Honestly.
Yeah, we do have a special one.
Yeah, you do. You have a special one just for you, Mother. Yes, the website there actually will kind of run you through what you can do to make sure that you're prepared for surgery, what can be done during surgery, and how to recover faster after as well. Also includes lots of kind of interesting statistics about surgical procedures and recovery.
Oh, I love that. I think, a lot of moms, this is why, this is very important to me is, we don't talk a lot about pain and recovering and coming back to work, and all of this affect our postpartum health, postpartum recovery, and everything that we moms, right, struggle with on a daily basis. So thank you so much, Dr. Storer, for joining us. Really, really appreciate you. We have 5 more minutes and we're going to wrap this up. Thank you for joining us and have a wonderful, wonderful, wonderful weekend.
Thank you so much. It was wonderful to chat with you, Blessing. Thank you.